Healthcare providers share a common and lofty goal: minimize patients' pain. But what if trying to realize this goal actually hurt more than it helped? The reality is just that. The US faces a new epidemic driven by the desire to do good. Opioid use and abuse is currently a major health crisis in America, and in order to fix this, we need to change our approach to pain management. But first, let's look at how we got here. In the 1990s, multiple professional societies argued that the need to improve pain management was a public health imperative. Such advocacy was based on the notion that the current state of pain treatment had led to unacceptable levels of physical and emotional disabilities. Pain soon became commonly thought of, measured as, and treated like a vital sign based on the combined educational efforts of major US health systems and leading pain societies. Additionally, in 2001, regulatory mandates emerged, which required hospitals to have pain management standards, including the process of recording the results of pain assessment in a way that facilitates regular reassessment and follow-up. So, what were the results of this social advocacy and regulatory activity? Opioid prescriptions skyrocketed. According to the CDC, prescriptions nearly quadrupled between 1999 and 2012. Even more alarming, the United States, only about 5% of the world's population, now consumes approximately 80% of the world's opioids. Okay, but the American experience of pain has improved, right? The CDC reports that Americans have similar amounts of pain, despite the fact that enough opioid pain medication is now prescribed to provide one bottle of pills to every American family each year. Well, at least harm from increased opioid use is in check, right? Unfortunately, no. Nearly 2 million Americans aged 12 or older either abused or were dependent on opioids in 2013. Even worse, death from prescription painkillers have quadrupled since 1999, killing more than 14,000 people in the US in 2014 alone. But how did it get so bad? Through fraud, methodologically flawed research, conflicts of interest, and money. Investigative reporting has revealed misleading information from pharmaceutical companies regarding the safety and effectiveness of opioids, coupled with inappropriate ties between companies that manufacture and market opioids and nonprofit organizations. Physicians who overprescribe receive higher patient satisfaction scores, which often translate into larger reimbursements from third-party payers. Ironically, this practice of overprescribing leads to increased rates of major morbidity and even death. National data from 60,000 patients reveals those with a higher satisfaction of care had a 26% increase in odds of death compared to those with lower satisfaction scores. While the present situation may seem bleak, there is hope. We can affect change and put an end to this epidemic by working together. Let's act by creating evidence-based prescribing guidelines, expanding the utilization of safer pain management techniques, such as non-opioid-based pharmaceuticals, cognitive behavioral therapy, acupressure, acupuncture, and physical therapy, disconnecting financial incentives for prescribing more, reevaluating pain standards that treat pain like an objective vital sign because it is not, expanding state policies aimed at regulating pain clinics to identify fraudulent prescriptions and improve access to naloxone. As providers, we have the power to decrease the unnecessary prescribing of opioids. Together, using a multimodal approach, we can improve safety around American pain management.